AFMC is really known.
And also make sure
Welcome to this edition of AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Kim Schuler, and Kim is the Arkansas Behavioral Health Integration Network CEO. Thanks so much, Kim, for joining me.
Oh, thank you for inviting me, Robin. I'm so glad to be here this morning.
So we are reaching the downhill stretch of the pandemic. What does that mean for the mental health crisis, especially in adolescents and college students?
Wow. That's such a great question. I think as we're starting to near the end of the pandemic or the public health event as we know it, I think one of the things that I realize, and I think that we've realized as a not just a mental health community, but as a community, is we have a mental health crisis. And we've had a mental health crisis that was brewing prior to the pandemic, but the pandemic's really highlighted that. And so now we're seeing numbers that have just skyrocketed through the roof. And so now I think as we're nearing the end of the pandemic, we've had this spotlight on the mental health crisis. And what do we do? How do we do things differently to treat and address our mental health?
So research is telling us that you can't get on your phone without seeing how adolescents have been affected. What are you seeing?
That's absolutely true. What we're seeing is that this has become really a digital generation. If you said, "Hey, Kim, do you have a phone with you today?" Absolutely. I have a phone right near me. I have two children at home. One's an adolescent, one college student. I don't ever see them without their phone. One of the things that we know is we have a digital generation who usually has their phone in their hand. And the more time they're spending on social media, the higher link to depression and the higher links to anxiety. We're seeing an uptick in cyberbullying. We don't really talk a lot about that. There's not a lot of information and education, I think, that's out there. When I think about what we could be doing, I think that we need to be preparing our kids for what they can be faced with when they are on social media.
And has there been a spike in anxiety and depression?
Yes. I don't have the exact numbers, but there's a definite correlation with after an hour and a half of usage on a social media platform, an increase in depression and anxiety. And the more usage, the higher the risk of depression and anxiety. And, there's so many platforms out there now. I know that we started with Facebook, and then we had Facebook and Instagram, and now we have TikTok and Twitter. And so there's Snapchat. Our kids are spending the majority of their time on these different platforms, and that's really affecting their mental health.
Is suicide also affecting this age group?
Absolutely. The CDC just put out a new report. And one of the things that they've identified, they said that nearly 60% of teen girls in the U.S. Reported persistent sadness. And they said 1 in 3 teenage girls seriously considered suicide. So this is absolutely a crisis state right now.
That's very scary and daunting as well, for sure. So what are we doing about it? What are providers doing? What can they do?
Sure. I think that there has been a lot of attention by pediatricians, by family physicians in starting to screen A lot of times we see routine screening in our doctor's offices for depression and anxiety. We're starting to normalize the conversation. Providers are talking to kids when they come in for their wellness checks and asking them, how are you doing? We're starting to see more public service announcements. We're starting to see more ads, even on social media platforms. We're talking about it. I think in school, at least we're starting to talk about it a little more. So we're really doing more education to normalize the conversation. I think that stigma is still a big part of this. Oftentimes it's hard for people to talk about their mental health issues. They don't want someone to know that they might be struggling. And so often we see this silently. So I think one of the biggest things that medical providers can do is really ask, are you okay? And let people know it's okay not to be okay.
So is telehealth a part of that kind of regrouping and transition now that the pandemic is over?
I think we saw a huge uptick in telehealth, right, with the pandemic. And now I think we know telehealth works. It reaches people. People like it. But I think that now it becomes, will this be paid for now that the public health emergency is over? And so lots of different insurance companies are paying for that. They are adopting programs for their members so they could provide them the support that's needed. But I think that it depends on what type of insurance you have and if your provider supports this.
How does that affect rural health?
That's such a good question, Robin. We do a lot of work in the rural health space, and I think rural health is especially vulnerable, especially the youth in our rural practices. There's a limit, there's limited resources for mental health. Mental health professionals, psychiatrists, specialty mental health providers in rural health areas. And telehealth is a great option to try to reach those vulnerable populations.
Arkansas has or UAMS has developed Arkansas Connect. Tell me a little bit about that. And is it free visits? Is it focusing on adolescents?
I'm so glad you brought up the AR Connect Now resource. AR Connect Now is a fantastic resource that is available to all Arkansans. They you can call them, and you can call 24 hours a day. They'll provide up to 6 visits. They're free of charge, and they've been developing a platform specifically geared towards 12 and up, and so that's wonderful. We make a lot of referrals and suggest and promote AR Connect. I think it's also important to know we need to be providing education on the new crisis suicide line, the national suicide line, that's 988. And so if you could put information in schools, in doctors' offices, in libraries, in public places in our community where a youth may be going, they might be able to text or call that line.
So you mentioned where our children are going, which majority is a classroom. Should there be a focus to bring mental health to the classroom?
Absolutely. In my opinion, I think that, we're asking our teachers to do a lot, but I think that mental health is a huge piece of this. Kids are spending 8 hours a day, 40 hours a week in the classroom. It's probably the place that they are the most. And so I think it's important to bring education and awareness, and again, normalize it's okay not to be okay. And mental health is part of our overall health.
Does that start with equipping our teachers, our educators to help kids?
I think that there's educators are a huge piece and component, but I also think that it has to do with our families and making sure at home families are talking about mental health, families are paying attention. It's important for us we see our kids every day, teachers see our kids every day, and to pay attention. Does something seem off with them? Does something seem a little different? Have they withdrawn? Are they not being as social? Are they not participating? Any change in behavior, and ask them, is anything going on with you? So yes, I personally think that schools can be a wonderful place for us to continuing to do some education and trying to normalize and really address mental health. I know some schools, especially the high school level, they're starting to bring some awareness around suicide, and they have support groups, and I think that that's a huge piece. I think NAMI, the National Association for Mental Illness, they're doing some work with high school youth, trying to provide education and promote mental health.
So what are the resources that are out there specifically for PCPs? What should they look for?
So for primary care, I think that it's great to continue to get continuing education on youth mental health. We know that mental health, youth mental health in particular, has something that's become common in everyday practice. And oftentimes, pediatricians may not have had a lot of training in the mental health component. And so I think that it's really important for us to be aware and have continue to look at what are resources, use screening tools, have conversations with our patients about mental health, stressors, social determinants of health, all these components, their relationships with their friends. Has anything changed at home? Childhood trauma, we know trauma is huge. I think, that's a topic in itself. But I think that the key piece is for pediatricians to be aware, to be screening, to be asking the conversation, and to normalize that mental health, that it's okay to struggle with our mental health.
So this kind of leads into the next question. We have to check on each other. We need to check on each other, and not just from a mental health perspective. What does that mean?
I think it's so important for us to ask someone, how are you today? You look a little down today, or you just don't seem yourself. Are things going well? So it's important for us to send a caring text, or email, or reach out with a phone call and just say, hey, I'm thinking about you today. And you're important. You're important to me.
So what are caring connections, and why are those important?
So caring connections are similar to what I just had mentioned, but it's where healthcare providers can reach out in a caring way with a caring message to let patients know you're not alone. I hear your struggles, but I want you to know that I'm thinking about you, and we have a support system. And if you need anything, we're here. And a lot of times we can send positive text messages, postcard, thinking about you, you're not alone, email, phone call, those types of communications.
Things that really are a part of our everyday life, for sure.
Absolutely.
Yeah.
Things that I might do with you even, Robin. Hey, how's it going? Or a colleague that I'm working with, thinking about you. Or you seemed really quiet in the meeting today. Hope things are going well. Those types of statements.
No, even personally, I try so hard to put that in front of every person that I'm in contact with, on a daily basis. How are you? It's one of the first things I try to ask, and a lot of it is just simply because I like for people to know if I'm not doing well. I want to know that I have a friend and someone that's listening. So those caring connections are so important.
That's great, Robin. I just wanted to make another point. I think we go through our day, and in our society, we ask people, "How are you?" Most of us respond well or good or fine. But I think it's important for us to stop and listen. And so oftentimes in our busy days, it's difficult for us to really stop and pay attention, even if it's just 30 seconds to focus on how is that person really doing and listening to their response.
Especially when there are teenagers in the house.
Absolutely.
Yes. Well, Kim, this has been such a pleasure, and I've learned so much, and I'm sure that our audience will too. I so appreciate the time that you've made to talk to me today and all that you do on behalf of mental health awareness and education within the state of Arkansas. Thank you.
Thank you, Robin. I appreciate it. Have a wonderful day.
Thank you. You too. And that's it for this edition of AFMC TV. Have a great day, and thanks for watching.